Hi, I'm Kara. I've been diabetic since 1986. I use a blood sugar meter and a continuous glucose monitor and an insulin pump to manage my blood sugar, or at least I try. I'm the founder of BootCamp for Betics. BootCamp for Betics is a collection of educational and self-improvement activities for people with type 1 and type 2 diabetes. Our goal is to help you become less dependent on doctors, Facebook, and Google by helping you learn how to analyze your body's own blood sugar behaviors, ultimately resulting in you making well-informed decisions as you manage your blood sugar on a daily basis. As diabetics, it sometimes seems as though everyone feels they have an obligation to tell us what to do, and I'm not just talking about doctors. I'm talking about friends, acquaintances, colleagues, family members, and even random strangers you see on the street. I'm sure everyone means well with their unsolicited advice, but setting hard and fast rules about what diabetics can and can't or shouldn't do just doesn't work. And many of the rules we keep hearing, some of which were established as far back as the 1950s, aren't even true or correct anyway. To be clear, there's no cure for type 1 or type 2 diabetes, and a magical cure is not what BootCamp for Betics claims to provide. If you're going to take this course, you need to have already accepted the fact that diabetes sucks and that there's no magical cure. BootCamp for Betics is designed to occur over multiple days or weeks, during which you're dutifully writing down your blood sugars and your treatments and your foods and your physical activity and other stuff. There are roughly 12 bootcamp segments, each of which is designed to be completed in a day or two. When you attend BootCamp for Betics, you can expect to spend your time doing stuff like studying habit loops and how to change them, correcting your baseline or fasting blood sugar, learning about the 30 factors that can raise your blood sugar, practicing weight loss techniques to find what works for you, learning about factors that lower your blood sugar, and even learning about what to do in a diabetic emergency. If it applies to you, you'll learn about advanced insulin management. If it applies to you, you'll learn about non-insulin diabetes meds and how each one works in plain, non-medical language, and more. You can also expect to spend between 3 and 15 hours engaging in your choice of physical activity if it's been approved by your doctor. You'll be recording your blood sugars on a form that looks like this, along with your carbohydrate intake, medications, including insulin if you take it, and events involving physical activity. You'll use your own records to diagnose and resolve problems with your own blood sugar. You can also expect to perform experiments on your own blood sugar by introducing various external stimuli to your own body and recording and analyzing how those stimuli affect your blood sugar. You'll complete some mini quizzes or knowledge checks after watching each segment. You'll engage in self-reflection exercises where you compile and calculate the results of your experiments and write up your own guide to blood sugar management that is unique to you. And if you attend the live version of BootCamp, you'll have an opportunity to talk with your fellow Betics at BootCamp via online discussion, and you'll be able to ask questions of the facilitator. Look, if it were just as easy as eating right and exercising, which is what the general public is constantly telling us to do, fewer people would be having all these blood sugar problems. In fact, if it were just as easy as eating right and exercising, there wouldn't be a need for highly qualified expert medical doctors and diabetes educators who focus only on diabetes patients for their entire career. To be clear, BootCamp for Betics is not a medical center. It's a program run by Brutus Partners, a training company in Madison, Wisconsin. So, if you're a type 1 or type 2 diabetic, or if you love a type 1 or type 2 diabetic, please consider signing up for either the self-paced version or the live version of BootCamp for Betics. Stop caring about your current A1C and instead start focusing on what you want your A1C to be. You'll find more information at bootcampforbetics.org.